Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Morning, everyone, and welcome to a Cardinal Minute. This morning, I'm pleased to introduce our Assistant Professor of Medicine and Hospital Epidemiologist at our Robley Rex Veterans Administration Medical Center here in Louisville. And that is Dr. Mark Burns, who is an amazing infectious disease specialist, and he will give us a summary of his grand rounds on the update on monkeypox.
Okay. Well, thank you. Thank you very much, Dr. Williams. With monkeypox, again, it's a zoonotic orthopox virus that has been seen to be a public health emergency as declared by the World Health Organization and the House and Human Services Division here in the United States. Monkeypox has been spread. It's usually spread through intimate contact, that is contact with someone who is infectious as they have lesions on their skin primarily. It is spread through portals, through the nasopharynx, oropharynx. It can also be spread by infected animals and also inanimate objects taken and exposed to these areas. The key feature to this current outbreak with monkeypox has been the monkeypox rash. Rash goes through basically 5 stages. It starts out as a flat macule, then goes into a raised papule. After a few days, it will become a clear vesicle, followed by it will turn into a pustule, and from there it becomes crusted and eventually fall off. A person is considered infectious as soon as this rash appears, and non-infectious once the crusted lesions have fallen off and you have regeneration of new skin. For the most part, people who are healthy without any immune problems, this is a self-limited disease, and basically they need supportive care and pain control. For people who are at risk, that is the young, particularly children, pregnant women, breastfeeding women, or people who are older, elderly, and people who have immunodeficiency, should be considered for treatment. Right now, there's no specific treatment for monkeypox. However, it's been shown that stockpiles of medications from the US that were used for smallpox have been effective against orthopox viruses, of which monkeypox is part of. So those treatments can be somewhat effective. It's best to talk with your provider, and they should refer to an infectious disease specialist about monkeypox if they have any questions. The primary take-home point, in my opinion, is number 1, to think about it, and number 2, anybody who presents with a rash who is in a higher demographic of people who have been acquiring monkeypox, they should consider the diagnosis and do appropriate testing.
That's fantastic. I really appreciate your giving us the update, and hopefully there'll be better recognition as we're on the tail end of it, and therefore it will not reoccur. Really appreciate your help with this epidemiologic threat. And that has been a Cardinal Minute.